Hello, my name is Dr. Arlen Four. I'm the chairman and founder of Activator Methods International. We want to welcome you to the Activate Your Practice podcast today. And we're very fortunate because we have the Dean of Logan University as the guest today, Dr. Kris Petrocco. Kris, welcome.
Thank you so much, Dr. Four. It is truly an honor, and I'm so grateful to be here with you today.
Well, you're the first woman dean of Logan University, and that's quite an achievement. And by the way, Dr. Petrocco is a double doctor. She's a chiropractor, and she's also has a doctorate in education. So we're really proud of her, and she does a great job at Logan. And I'm fortunate that I'm going to be able to ask her a few questions today. And I would like to start with, how do you see the future of the profession from an academic standpoint?
So, Doc, that's a really great question. And, when we think about the individuals that we serve, the public that we serve, the students that we're training to serve the public, I see the profession growing in a sense that it becomes more diverse in that population we're serving. And when we look at what we need to be doing as practitioners and how we're going to grow in that aspect, that's looking at different environments to work in. How well are we serving that geriatric population? How well are we serving the women of the public and the children? And are we working functionally in interdisciplinary care? And how can we collaborate better and stronger with different healthcare providers? So I really see the profession moving in that direction, that we start to treat and care for all of those different populations in a much better way than we have in the past.
I heard you say integrate, and I think that's a good word because I think the chiropractic profession has grown enough that we can integrate. And I know your husband happens to be a VA physician, and I started the VA chiropractic program here in Phoenix, and it allowed us to work, integrated into the medical profession. And what I found out, and I'm asking you the same, I found that they were very accepting, and as long as we did our job and kept our records clean and worked with them, we had no problem. Is Jason finding the same thing?
And I think that's true. Collaboration, right?
Yes.
And really being collaborative with those providers. And, one of the big things that I think happens frequently is that we forget that other providers aren't trained the same way that we are. And so often they don't recognize what we do and how we do it and how we can support the patients that they're trying to care for as well. And so, practitioners tell me all the time, "Oh, Kris, I have a GYN in my town and they know exactly what I do." And I say, "But do they?" And, we for so long forget that education piece for those providers is just as important as it is for our patients, so that they understand how to care. And, Doc, you said something else about working collaboratively with practitioners. And, we've talked about so long the opioid crisis in our profession and how patients are utilizing opioids across the U.S. This is not a new conversation, not only for our profession, but for all of the different populations. But the piece is, when you think about the other providers, they were trained in that medical model. And so they were trained to write a script, they were trained to give a drug, and often they struggle with, if I can't do that, then what's the next step?
A very good point. I remember one day I was standing in the coffee line, this was several years ago, and the head of rheumatology walked up behind me and said, "Hi, Arlen, how are you?" And we're talking. And he said, "I hope you guys never leave." And I said, "Well, what do you mean?" And he said, "Well," he says, "we're only allowed to give so many class 4 narcotics, and then we don't know where to go. So," he said, "this way we just send them down to you." And so I said, "We're the dumping ground?" And he started laughing, and he said, "Well, kind of." But I said, "Well, what did you find out happens when you dump them on us?" Well, he said, "You know what? Many of them get well." And he said, "So please never leave." And by the way, you were right. I had to give a lecture to 100 MDs to show them what we were doing. And afterwards, they were very happy to ask questions, and they just didn't know. And so you're exactly right.
And I think it goes beyond, interestingly enough, I was a part of a group that worked at worked on collaborative care with a pain grant that we received in the past. And there was a group of providers that came together and would talk about case studies and how do we prepare students and how do we prepare professionals to work collaboratively together. And there was a hematologist that was on this group. And we started talking, and she was talking to me about a sickle cell patient that she had. And she said, I never really thought about complementary and alternative choices for pain. And she talked about how the adolescents she was treating with sickle cell would have so much pain, and she couldn't treat them in a way that would alleviate all of their pain. And so talking about not just what we do as chiropractic, because we know that there's some contraindication for patients with sickle cell depending upon what their blood levels look like and those sorts of things, but looking at other complementary things like music therapy or acupuncture or mindfulness, and thinking about mindfulness and whole health is another avenue that our profession really needs to be thinking about, because that is becoming part of future mainstream healthcare.
When I was just starting, there was a kind of a thing going around that women, when they graduate, they never last more than 7 years in practice because they got married and had children, and then they were out of practice. Do you think that's holding today, or do you think we got new numbers?
I think we have new numbers. I don't know what those numbers are, but when we look at student enrollment, for instance, at our institution, we recognize that there are more women entering into the chiropractic profession than ever before. I often tell the story of when I entered into chiropractic college. I'm going to date myself, early in the 2000s, and we had the admissions counselor very proud of saying, there's 20 women in this class. And, me thinking back on that, thinking, wow, that was such a small number in a class of, 120 or 130. And we're watching our numbers change at our institution. And again, we're not only just seeing that in the enrollment side of students, but also in leadership.
Yes. And it seems to me, as I've observed this whole thing, that the glass ceiling has been broken, if you will. And so women are rising. I mean, look, Activator has a CEO that's a woman, so we've been way ahead of the game. But I see women, and for example, I noticed it in Europe first, and they're 60-40 women. Mm-hmm. And so that's where it really became obvious. So come back here, and so what do you think? Do you think there are more women than men now enrolled?
It definitely, we are seeing that enrollment trend changing, especially in our program, that there are many more women than men. And I think, when you look across the profession, you're seeing many more women step into academic leadership roles and really wanting to move the momentum of the profession forward as a contributor.
Yeah, I've seen, several. I can think of one right now, McTimony, College, and she has 4 different universities in 4 different countries. And I think she's a disruptor, I call her, because she's doing a good job of disrupting the way education is being done. Do you think that's happening in the U.S.?
I do think so. And, I think that for so long, chiropractic has moved along incrementally. And now we've got many new thought leaders and perspectives, regardless of race or gender or ethnicity. And the diversity that's being brought to the table is much more significant than it was in the past.
What's the big changes you see in the academic world?
So the big changes, being seen in the academic world is really, truly serving our population of students. We've got great diversity in our population of students. We're starting to have much more diverse leadership across the profession. And all of those really coming together are really shaping and forming how we're changing.
What's the biggest innovation you see in chiropractic education?
And you bring a really good point about innovation, Doc. Innovation, our students are wanting to see much more technology. They're much more contemporary mindset practitioner as they're entering into programs. And really thinking about the delivery of our education, right? And how are we delivering curriculum and content? No more is going up to a blackboard and using a piece of chalk, the delivery method that students are needing, wanting, and desiring. And training that practitioner of the future becomes much more important, and the level of technology and innovation is also really important to our programs.
Well, Logan was one of the first to adopt the digital training, like we put together an activator. And my wife, she's a strategist, and she said, you're going to have to do this digitally because, one, she said, you're getting old. So she said, you got a lot of experience and you need it. By the way, it took us 3 years to digitize everything that we had learned over 55 years. And she was right that we were able to get this across. And then the pandemic hit, and Logan didn't miss a beat because all of their stuff was downloaded on their kids' computer, and they took them home and they continued right on. And that was a hard thing to get across to the academic community because they didn't want to lose their jobs, quote unquote. But if they had thought about it much, they could use that technology, and their job is safe. All they have to do is help organize it and get it out to the students, and it wouldn't have been any loss to them at all.
And Doc, I think that's such a great point about innovation and technique, right? That what Activator has done for programs, especially training individuals in activator methods, the student in particular has that opportunity to go through that virtual training and then be reinforced in the classroom with that hands-on technique and skill. And that really changed the paradigm of how you can deliver technique and verify competency in students. And I think that competency piece, it goes right along with safety.
Well, and it's a blended program, as you say. They can, and we found out because we had 150 instructors one time, and we saw there was variation as much as we tried to stabilize it. But with digitizing it, it comes from me, and I'm the one that's saying it. And if it's a mistake, it's mine. And we were able to get it standardized then. So then the college instructors, a kid would raise his hand and say, "That's not what it said," and they'd have to go check it and come back and say, "I made a mistake." Sure. And it was good for them also. So I think you're right. It's a real innovation. What do you see on campus today compared to when you went to school?
So you're asking me to date myself
Yes.
again, huh? So, it is really different. I often tell students when they're coming into chiropractic college, I'm very jealous. And I'm jealous because, there's all this new technology. We've got the force sensing tables. You mentioned your innovation with Activator and how they can train in a virtual type setting and then be reinforced in the classroom. There's the anatomage tables that we have on campus that we never had as students. And so all of these really unique contemporary technology reinforcing all of that curriculum, it is really, really fantastic. And it's really changed the way that we deliver education to our students. Even talking about putting some of the curriculum online, and you put coursework online and they can access lectures 24/7, very different than pen and paper or, the chalkboard and taking notes. It's transitioned.
And that's a good thing, I think, because then you've got standardization, and that's what we always look for is standardize everything. So you're saying, here's a practice in Phoenix, and they're doing the same thing as a practice in New York. And, getting doctors to follow something is a very difficult thing because each one has their own idiosyncrasies. But once they find out something works, then they come back to it again, and so it makes a more standardized process. My last question or observation, I guess I'd say, is when you were up for dean, one of the biggest supports, or two different groups were supporting you. One was the faculty, which was understandable because you're part of the faculty, but the students. Students hardly ever go out and support the new dean, but you had that rare, thing happening to you. Why do you think they were happy to support you?
Doc, that's a really good question. And I have to say that there's three things, actually, not one thing, three really important things that drive me every day when I climb the hill at Logan. And that is obviously doing right by our profession and making sure that everything that goes on during the day supports what we do as a professional, as a chiropractor, and does good for the public. The other piece is really truly making sure that our students have the best educational experience they possibly can. And I absolutely love the students that come into Logan, and I love our faculty. And I know that sounds, a little bit cheesy in that aspect, but the students are the future of our profession. And I always tell them, someday I'm going to want to retire. And I hope that there's somebody out there that can do it better than me. And I hope that wish is for every single student that graduates from Logan. And that's how I start every single day.
Well, it worked because the students were right behind you, hoping that you became the dean. And by the way, I know you well enough to know that you can be a hard ass too.
Yes.
And that's another side of the dean. But it straightens people out. But as my wife will tell you, I say, how do you get by with being tough like that? And she says, I'm fair. And she said, that's why Kris does really well, because she's fair. So
thank you. I appreciate that very much.
Well, we had a great time here, at least I did.
Yes, I did too.
And so Dr. Kris Petrocco, the Dean of Logan University, thank you for coming and really enjoyed it.
Well, thank you so much for having me, and I hope we can do this again.
Yes,
Sounds
absolutely.
great. Thank you.